Hello, everyone. Welcome to today's live office hours webinar. Sorry, we are getting started a little bit late. Today, we will be offering the opportunity for you to ask questions either verbally or in the Q&A chat feature. We'll also cover questions around data submission and 2022 recognition in our outpatient program. Target BP, check change control cholesterol, and target type 2 diabetes. So on behalf of the American Heart Medical Association, I want to thank you for taking the time to join today. My name is Liz Montgomery. I am a healthcare data analyst working with the AHA and AMA on all things outpatient. And I'll be presenting most of today's slides with my colleagues, Allison Smith and Allie Bateman. Allison, would you like to introduce yourself first? And then Allie, if you can follow her.
Thank you, Liz. Good day, everyone, morning or afternoon, depending on your time zone. Thank you for joining us. I'm Allison Smith. I'm the Program Director for Target BP. I'm a nurse and a public health professional supporting this joint initiative of the American Heart Association and the American Medical Association. Today, I'll be answering and addressing some of the questions for Target BP related to data submission, both in terms of population data as well as the evidence-based blood pressure measurement criteria. And with that, I'll turn it to Allie Bateman.
Thanks, Allison. Good morning and good afternoon, everyone. My name is Allie Bateman. I am a Qualities Program Manager for the American Heart Association, and I will be supporting Liz and Allison today during the Q&A section. So I'm looking forward to hearing everyone's questions and supporting where I can.
Thank you both. Before we dive in, let's go ahead and review a few housekeeping items. All participants should be able to come off mute to voice questions here in a little bit. We'll have dedicated Q&A sections for this throughout the presentation. To ask questions in between these phases, please type your questions at any time in the Q&A feature. We'll either answer directly to you in the chat or when we pause for questions between sections. So others can't see these questions as you type them in, and so we'll have Allie repeat them out loud and do our best to broadcast answers in that chat feature. After the webinar, we'll be emailing the slide deck and recording out. Immediately after the webinar ends, you'll also see a survey appear. It should really only take a minute to complete, and we would appreciate any feedback you can provide that will help us to improve these webinars moving forward. For any general questions after the webinar, you can always send them to our Contact Us form, which is that bit.ly/AQ contact us link, or contact us on any of our program websites. And for quick requests like password resets or new user accounts, you can contact our IQVIA support help desk at the email address on screen now. So let's go ahead and get started. For today's agenda, we have already wrapped up the introductions. Then we are going to move forward with opening the floor for any immediate questions. In case you have a specific question on hand and maybe can't join us the whole meeting, go ahead and plug those questions in right away. Then once we get through those, we'll have some slides that cover our timeline, reminders, some of our available resources that might answer additional questions you may have. Following that, we'll have another open Q&A session. Then after we move through those, we'll cover some of the more common questions that we've gotten in the past and additional Q&A after that if we still have time and still have more questions coming in. So while we are having the open Q&A, please feel free to come off mute. But as we go through slides, it would be helpful for you to stay on mute. So I'm going to go ahead, give you the option to unmute yourself. And we can go ahead and see if we have any questions to get started. And I'll pause for just a second to see if any questions are coming in. Give it a moment to go ahead and see. Allie, do you see any coming in yet?
Not yet.
All right, so you should have the option.
I see one hand raised, sorry. It looks like Dorothy Braden has a hand raised. Dorothy, if you have a question, you can unmute yourself. All right, we'll get back to you, Dorothy, if you still have a question. I also see a question. Darlene Whiteblood also has a hand raised. Darlene, if you want to go, it looks like your hand is back down. All right, well, keep us posted. We'll have a few pauses during the presentation that you're more than welcome to raise your hand, and we will incorporate your questions into the time together. Thank you. Back to you, Liz.
All right, thank you. So now just to walk through some of those reminders and resources I mentioned before. Diving into the recognition timeline, the data platform, as I'm sure most of you know, is now open for 2021 data submission. The deadline is going to be Friday, May 27th at 11:59 p.m. Eastern. So you can revise your data at any point up until this deadline, but whatever is saved at that time is what will be used to determine everyone's award status. Also, please note the Eastern time zone. We know it will be a little earlier or later depending on where you are working from. We also want to encourage you to submit your data early, given the unknowns both around the pandemic and any other technical issues that might come up. We'll take a few months, then review those data submissions and notify awardees in the September-October timeframe. There are many benefits to participating in these outpatient programs. Awardees for Target BP are recognized in annual AHA and AMA meetings, and all program awardees are posted on our program website and publications. And we'll have a press release and comprehensive promotional toolkit to help promote your achievement. The outpatient programs are intended for organizations that are directly providing patient care for chronic diseases. And to be eligible for an award in 2022 or in future years, the submitting organization must be diagnosing and treating patients up to and including prescribing medications. The vast majority of organizations do this, but for the handful who are in more of a referral role or an educational role, we do have other spotlight opportunities to highlight your organization's contributions. So please work with your local AHA or AMA staff to learn more about what those opportunities might look like. For the basics, there are 2 steps to submit data for recognition. The first step is to register. This enables us to create a profile and user login for you in the online data platform. If you're new to submitting data, please go to heart.org/registermyoutpatient.org to register your organization. In this form, you can register for one or all 3 of the programs at once. So if you're debating if you just want to do Target BP and maybe one of the others, it might be easiest to start by registering for all 3, so you won't need to go back and register again. If you've submitted before and already have a profile, you do not need to re-register. You can skip straight ahead to entering data, which we'll cover next. And I will note that 1 registration equates to 1 potential award. If you want your health system and each of its individual locations to be listed individually and each receive recognition, you'll need to submit registration forms for each of those sites. If you're registering 5 or more sites at a time, there is a multi-site submission process in that same registration link that will save you a little bit of time. Step 2, here we go. Wait, no, skipped one. Step 2 is that once you receive your user credentials by email, you'll head to our online data platform. You'll navigate to program forms, hit add new, enter 2021. This is because you're entering data from calendar year 2021. Then fill in all the fields and save and exit. The deadline to enter and finalize your data again is May 27th at 11:59 p.m. Eastern. So the minute after that is when we take a snapshot of all data in the platform, and that determines every organization's award level. And this leads us into doing a quick overview of the specifics for each program. I'll go ahead and pass it over to Allison Smith with the American Medical Association to get us started with Target BP.
Thank you, Liz. And I just wanted to pause here 1 second because I do see another hand raised from earlier that I overlooked. Is it, I may be mispronouncing, is it Tamal Thakar? We're certainly welcome you to unmute yourself and ask a question if you wanted to do so now.
Hi there, thank you. This is Tim. Can you hear me?
Yes, thank you.
Great. Yes, I had one question. So when gathering this data that we will be submitting, it seems like we're going to be giving summary data, correct?
That is correct. This is aggregated data, not patient level data.
Okay. So I guess my one question that I've been going through, if we are to pull data from our organization to give us an idea of the patient's last blood pressure reading that we have during the calendar year, how do we ensure that there is not a more recent blood pressure that we maybe did not get a claim for, did not get entered properly? Is there any sort of process or method that Target BP has advised or used in the past?
That's a great question, and I'll start, but certainly invite Liz to chime in here as well. Pulling data is something that's very specific to each health, EHR. And some organizations have, easy reporting functionality that helps with that. Others have an augmented, like a population health module that sometimes can make that easier. We can certainly talk offline about the specifics of your situation, and happy to do so. Liz, I don't know if you want to add anything else at this stage.
No, I think that that's a great way to sum it up. It's really hard to know individually what the best guidance is in navigating your situation, but we'd be happy to connect offline with that.
Yeah, so Tim, thank you for that question. If you want in the Q&A, the question function, you can send a private question with your contact information, and we can follow up with you afterwards to see if there's some EHR, specific insights that we might have. So I appreciate you certainly wanting to get the last available blood pressure. So thank you for your attention to detail there.
Sounds good. Thank you so much.
Sure. I don't see any other hands at the moment. So I'll press on here, and we'll dive in a little bit to, as you can see on the screen here, some of the data submission requirements for Target BP. Many of these are the same. There are only a few nuances this year that I will highlight, but essentially, we start with the overall adult patient population, sort of the largest number here enumerated in number 1, and then we move on to the total number of patients, adult patients diagnosed with hypertension who had a visit in 2021. And then we narrow that focus even further with the number of those patients diagnosed with hypertension with a visit in 2021 who have their blood pressure controlled. We are also asking a question to indicate whether or not this includes patients who have had remote blood pressure readings, because we're trying to appreciate the degree to which you're leveraging telehealth or self-measured blood pressure. And I'll talk a little bit more about that in a second on the next slide. But and then we're also looking for the total number of providers, meaning anyone, physicians, nurse practitioners, PAs, who play a role in diagnosing and treating hypertension. And then we also are looking for some high-level reflection of your primary payer groups. And by that, we mean Medicare, Medicaid, private, other public payers, uninsured or self-paid patients, as well as unknown. And that helps us appreciate the diversity. Another sort of measure that it helps us appreciate the diversity of your patient population. So now let me touch on some of the new things in the Target BP portion of data submission for this year. And that is, we've really streamlined the race and ethnicity data questions with what used to be 45 individual fields using the prevalence estimator down to 16 fields that really align with the UDS race and ethnicity fields. So hopefully for many of you who are also reporting to UDS, this will really streamline your data submission. And then lastly, the only other tweak is really adjusting one of the evidence-based blood pressure measurement criteria questions from a sort of fillable form to a drop-down menu. So on the next slide, I want to talk through some of the This was true last year also, but just to refresh, because more and more organizations have adopted self-measured blood pressure, SMBP practices, you can include in your measurements for persons who had office visits, but also those who had telehealth encounters, so long as they were capturing blood pressures on an automated device that had the ability to store with a date and a timestamp, and that the information was shared one of a few ways. One is either that's shown on the video with a provider so the provider can witness those logged readings on the device, or that data is electronically transmitted to the provider through a number of ways, through an RPM system or others that are enumerated in the more detailed guidance, but that they're transmitted in a way that the patient isn't able to intervene or edit that information at all. So it's coming essentially directly from the device to the provider. And then the other update that was true last year as well is that we're including patients who are diagnosed with hypertension at any time during the reporting period. Next, I'll move on to the evidence-based blood pressure measurement activities. These are the questions that help to qualify organizations for the Silver and the Gold Plus levels of award. And these have essentially remained the same. We're trying to assess these 6 main questions, and if you satisfy 4 out of 6 of these, you will qualify for either the Silver or the Gold Plus award, depending on your corresponding control rate. But we're assessing if you calibrate devices according to the type of device and the guideline recommended frequencies, which can be as short as 4 to 6 weeks if they're manual and handheld devices, or as long as up to 1 to 2 years for many of the automated or oscillometric devices. We're also looking to see if you're checking the validated device listing to assess if your devices are validated, and if so, what percentage. There is not a minimum threshold that need to be validated at this stage. We just are trying to assess progress in that regard, moving toward the standard of care. And then questions 3 and 4 are about your efforts to strengthen the knowledge and skills of your staff every 6 to 12 months. And criteria 5 and 6 assess the processes of care, whether or not you're using a protocol to capture confirmatory measurements through a variety of means, either through SMBP, ABPM, or repeat in-office measurements. And then lastly, if you're posting a visual reminder, an infographic at every place where blood pressure is measured in office to promote accurate measurement technique. All right, well, with that, I will turn back to Liz, unless there are any interim questions.
Right, I'll go ahead and move forward. We'll have another Q&A session coming up, but Allie, feel free to jump in if something is pressing on the slides that Allison just covered. I will go ahead and talk a little bit about check change control cholesterol and how it is similar to Target BP in a couple of ways. And we also ask for a little bit of additional information. So similarly, we require aggregate 2021 patient data for patients over 18 years. And these fields include the totals for the adult patient population, the total number of providers, and a breakdown of the patient's primary payer groups. Those will be the same questions that you're seeing in Target BP. We'll also ask for the patients meeting any of the 3 risk group criteria for change control cholesterol. And this will be for ages 21 years and older. Of those patients, we'll ask for the total who are actively using or who receive a prescription for statin therapy at any point during that measurement period. We'll also ask for information on your use of the ASCVD risk score. So how is it calculated and how is it documented? There are 2 changes this year to the change control program form. And the first is a new question that asks you about treatment plans for managing very high risk patients. And then the second is that we'll be adding that same race and ethnicity field that Allison mentioned for Target BP. That will be added to check change control cholesterol as well as Target type 2 diabetes. I'm going to go ahead and cover the same kind of overview for target type 2 diabetes, and then we can go ahead and pause for some more questions. The first three fields, again, for target type 2 diabetes are going to be the same aggregate patient data questions. Then additionally, we will ask for the number of patients with a diabetes diagnosis and an office visit in 2021, and the total number of patients diagnosed with diabetes whose most recent HbA1c level performed in 2021 is less than 9%. We'll ask for more information on your protocols for type 2 diabetes patients as well. So does your practice have a specific protocol to assess key characteristics of patients with type 2 diabetes? And then, like, if yes, what characteristics? And does your practice initiate a specific treatment plan for patients with type 2 diabetes? And then if yes, how? The only new addition for 2022 is our race and ethnicity questions, which I had just mentioned before. But I see that we've had quite a few questions come in. So if we wanted to go ahead, we can jump into some of those questions.
Liz, we do have a few questions. The first one is from Jennifer, and you may have already touched on this. How do I get to the data platform?
Sure, great question. So I'm going to go ahead and jump up a few slides to right here. All right, so you're going to log in at aha.infosarioregistry.com, and that will be the data platform link. You can also access this link by going to any of our program websites, so targetbp.org, and then you should be able to find a link directly to the platform there as well.
Thank you. Yes, we do have another question. Someone asked, we currently have the organization listed as one entity. Are we able to submit data for all 7 sites separately?
Yeah, that is a great question. And we're gonna, I've got something for it a little bit later, but essentially we'll be asking you to, you can do one of two options. So if you go to our registration page, then you can register at this website and fill it out each time for the other, if it's 7 total sites, you can register for those 6 additional sites individually. Or if you wanted to submit data using our bulk data uploader, and that's the part I'll go into a little bit more detail later if we have time, that way you could upload the data for all 7 sites together at once. And you can still go to this link, and within this link, there will be a option to go to a multi-site registration page. So we do have a different registration page for this, but to make it easy, just contact us or contact your local AHA staff and we can walk you through those steps. I know I jumped around a little, but hopefully that was helpful. This will be your go-to website for any registration questions. And then our bit.ly/AQ contact us form, we can walk you through any aspects you have questions on.
Great, thanks, Liz. And will these slides be provided to everyone after the session has ended? That was a question that we got in.
Absolutely. Well, we'll email out the slides and recording this week to all attendees.
Great. We also had a question come in. This one's a little bit long, but I think you and Allison can maybe tag team this. In the BP control question 3, it mentions that the patient must have at least 1 office visit in 2021. This question will break it down to primary payer and ethnicity. For the diabetes and cholesterol worksheet, it does not mention that the patient need to be seen. I was under the impression that all 3 measures, this data would be the same. So the question is, do we only bring back patients that have 1 visit in 2021?
Yes, so we do want to make sure that they have had an office visit in 2021 for all 3 of the different programs. The language should be consistent across all 3. I think that it does not appear that way, but in practice it is. So we are looking for a patient who has had that one office visit, and then also meets the following criteria.
Yeah, and I would just add to that, thank you, Liz, to say there was a similar question coming up regarding how we define active patients. And so I think that answers that question, which is patients who are seen within the calendar year of 2021.
Great. Okay, Liz, I think we can move on, and we have a couple other questions, but we can kind of attend them at the end of the PowerPoint. I think you're going to cover some of them, so we can circle back.
Awesome. Thank you so much. All right, I'm going to move forward. I had one more slide for target type 2 diabetes I wanted to highlight. So there is a difference in target type 2 diabetes from the other two programs, and that we also ask you, in addition to the requirements I had just covered, to submit at least one of these two options below. And you can either submit data for the MIPS 438 statin therapy measure or the MIPS 438 controlling blood pressure measure. These correspond with the data from the other two programs, and you can you don't have to submit for both of them, but we do require you to submit for one of these two options. And they do have different age ranges, so just note that while you are completing the program form. All right, I'll move into some of the resources we have. These can help you moving forward, just to make sure that you have everything on hand that you need. So as you are preparing to submit data, I would refer you first to our data collection worksheets. These are attached as handouts to today's presentation. They break down each question in detail, especially for the payer group question, and they are available for all three programs. While you spend some time looking at these prior to submitting data, you can consider who within your organization should be consulted for different questions. For example, the person who is pulling your data numbers, your aggregate numbers for total patients, might be a different person than who is familiar with staff training practices around blood pressure management, which is a question asked for our BP activities. If you're looking for more guidance around our around the submission portion of this, we do have a quick start guide, and that is also attached as a PDF, and that'll show you screenshots walking through a step-by-step of submitting data. Along with that, we do have step-by-step walkthroughs of navigating the data platform and submitting data. You can visit our program websites to access these. They're also on our YouTube channel and will be included in a link following. I'll add them to the chat here in a bit, but also in the follow-up email, so you have an easy access point to walk through all of the navigating at the live a live presentation of walking through the platform. Beyond that, we've added additional resources for our evidence-based BP activities. That includes an FAQ and specific examples to those activities. You can find them quickly on our website by going to the navigation page and clicking the link in the middle of our graphic of the different levels of recognition. I will note here that the participant status is going to be available just for first-time data submitters this year. If you're working to get to 4 of 6 evidence-based activities for future years to achieve silver or gold plus, please work with your local AMA and ANJ directors. We'd love to help you get there and help you achieve those evidence-based activities. We also have a few tips for success as you get started. We want to make sure that you are registering your organizations early, especially if you're a new organization or are making any changes, to enter and save your data as early as you're able to. We know that sometimes you have somebody new submitting data and they may have been familiar with everything, but there might be an issue with logging in or walking through the different resources, or that one question that might be a little bit difficult. And again, with just the state of the pandemic and offering vaccines, we never know what might come up. So the earlier you can get your data started, the better shape you'll be in before the deadline. When entering data, just make sure to use our data collection worksheets and these different resources we've put together for you, and complete all of the fields in all tabs, excepting that one option for target type 2 diabetes to make sure that you're good to go. If you click the data entry complete checkbox as part of that, you'll know that your data is complete, since that only becomes here to help as you enter your data and throughout the year. A few other tips for success is that in all programs, the first two questions do have to be yes to be award eligible. So we're asking if your organization diagnoses and manages patients. So that goes back to the beginning when we were talking about award eligibility. And then second, you are attesting that you are a designated representative of your organization and that they're accurate to the best of your capability. In Target BP, the Silver and Gold Plus award eligibility questions are those BP measurement activities. So make sure that all of them are answered, even if you don't, you can select not sure. And in check, change, control cholesterol and target type 2 diabetes, there is an additional question asking for your commitment to improving, and you have to answer yes to be eligible for recognition. If you're looking for additional features of our data platform, you can complete our site characteristics questionnaire, which is under form management in the platform, and that will give you additional benchmarking functionality so you can see how your organization compares to others. I mentioned for Target BP, that second BP measurement activities tab, and all three programs do have a second tab of data to enter in order to complete your full data submission and receive recognition. So the first one is that BP measurement activities, and then for check, change, control cholesterol and target type 2 diabetes, that will be the measure submission tab. So make sure you navigate to the right and answer that there. I mentioned earlier regarding our self-service bulk data upload option, or if you're submitting for data for more than 5 sites at a time, this is what I was referring to. So it allows you to enter your data into a spreadsheet. So there would be one for each program. And then you can upload that into the program versus manually typing it into the platform. So if you have more than 5 sites and are interested in this, you can complete that system registration form, and your local AHA director and our team at the AQ Contact Us form would be happy to help you get started. This is just a quick preview of what that upload function looks like in the platform. You'll populate a CSV file and you can just drag it and drop it into the platform. We also created training videos for navigating this process, from gaining access all the way through to using that upload tool. So if you are walking through that, these are great resources to access along the way. And that wraps up those first slides. So if we wanted to have open Q&A now, I will note before we jump in that we tried to do this as a quick Q&A wrapping up at 12:45 Central Time, but I believe Allison and I and the team can stay on for a few minutes longer if we need a little bit more time. But Allie, could you share some questions with us?
I do. So I do have a question from Sam. Sam asked, does the reporting for the 3 measures follow the UDS ECQM guidelines? Can we use our reported UDS data to submit?
I will say it does follow the UDS guidelines, and the exact specifications should be, hold on one second. I'm going to go ahead and pull up a slide that shows that a little bit more. So they follow the reporting requirements for 2021 health center data, and I would just walk through to make sure that is in alignment. Allison, would you want to add anything around navigating that resource properly?
No, I think stated it clearly, Liz, and this relates to the race and ethnicity aspect of the data submission, which is clearly aligned with the UDS. I think Sam's also asking about some of the clinical measures, the controlling blood pressure, cholesterol, and the diabetes measures, to see if they align with the UDS measures. And that's something that we certainly can clarify offline if you don't have off the top of your head.
Yeah, I think for those measures, I'd want to clarify and make sure that they are correct. You can access all of the specific measure criteria in the program library, and they are linked to in the program form. So if you are looking for that full breakdown, we try to make that easily available. But as to the exact measure alignment, I will have to track offline and would be happy to reach out with that conclusion after the webinar.
I can certainly say that for the blood pressure measure, it's aligned with MIPS 236, if that's helpful. And again, we can send out more clarification.
I can give the measures specs here. I think I have them in the slide.
Okay, looks like we have some more questions, Allie.
We do. The next question is, we submitted as an organization last year, but would like to submit by individual clinic this year. What are the next steps to individualize recognition?
So I would say for the best next step is going to be talking to your local AHA director. They can help you navigate what resources to use and make sure that you're remaining consistent so you can still access previous year's data. But if you're looking at more moving from submitting multiple sites underneath a system to submitting individual sites, you'll probably be moving to that system registration form pretty quickly, but I would work with your local director just to make sure, again, that we don't duplicate any data and make sure that you retain the access that would be most helpful for your organization moving forward.
Great, thank you. Next question is, to confirm, the total count of patients for the organization is only those seen in 2021, correct? Then from those, the breakdown based on diagnosis.
Yes, and the specific measure criteria would be referenced for any, exclusion for that year's data, but we are looking for patients seen in 2021.
Great, thank you.
Yes.
And that really concludes most of our questions that I'm seeing in the chat. We did have someone ask, is there a report manual available? But I believe you kind of already covered that. So I don't know if you want to show that slide quickly so that person can maybe take a screenshot or just refer back to it. And then we did have one question around if they don't have a login available, how do they get access to their username and password, if you want to touch on that.
Sure, great question. So again, we do have this data user guide, and I am highlighting it on the screen now, but you can also access it from the handout, which is included in the GoToWebinar panel. And from that handout, you can navigate the different step-by-steps for screenshots, or if it would be easier for you, you can also see a video walkthrough navigating the data platform, which is the first one here. That doesn't get too in the weeds for the data submission portion, but we'll give you an overview of stepping through the data platform for where to see how to submit data, but also your library full of helpful resources and other operational reports that would be helpful for an organization. And then the second question, how to get an updated user account, I believe was the question, or a reset on your password. For either of those, you can reach out to the IQVIA support help desk at infosarioutcomesupport@quintiles.com, or you could send it to our AQ Contact Us form, which is available. You can reach out to the Target BP Contact Us form, or to this directly, and we would be happy to help get you into the data platform.
Yeah,
Are there any other?
I just want to chime in to say the videos that Liz created, or say, it's screen by screen, click by click. They're really terrific. So even if you've done this before, it's been a year probably since you've done it. So it's a great refresher, and really highly encourage using those videos.
That's a great point. We some of us here, we're in there all the time, so it's easy to forget that it might have been a while since you've been in there, and there are a lot of great resources as you submit data. So great points. Welcoming additional questions if you have them. I'm going to move forward and cover some of the common questions we receive for a couple of minutes here, and happy to pause if other questions come up. So Allison, I don't know if you wanted to help answer these, but so for Target BP, how do you attest to completing 406 evidence-based blood pressure activities for Silver or Gold Plus?
Sure, I can quickly talk through these just to highlight some of the common questions that we do get. These questions for the 6 evidence-based blood pressure measurement activities really are yes, no, or I don't know questions, with the exception of one, which is to report a percentage of your devices that are validated, which could range from 0 to 100%. We don't request proof or evidence of your attestation statement. We do, do this on the honor system and hope that you're reporting, what your current practice has been in during 2021. 2021, to be clear. That's not something that, we did a training last week, does that count? Well, that would count till next year's recognition. And sort of the next question, I think, sort of moves into that, which is, how do I answer these questions? Because oftentimes it's individuals who are pulling data from an IT or QI standpoint and may be not have their pulse on some of the current clinical practices. And I think that's where the care team comes in, and having the collaboration of your clinical partners to understand what your practices are, perhaps your biomed team to understand how you're caring for or selecting your equipment. So blood pressure is a team sport, and recognition is no exception to that. So, but you always have the option of saying not sure. The downside of that is that you then wouldn't be eligible for that criteria counting for the Silver or the Gold Plus. So we really highly recommend chasing those answers down, and the colleagues that can weigh in on them, to make the most of your award status. And then just lastly here, if you have questions about the specific evidence-based blood pressure measurement activities and what counts and what doesn't count, we have many more resources listed here where we actually give examples that might clarify some of the common questions that you have, or otherwise contact us and we're happy to talk. So
great, thank you.
I don't move to the next one, or I don't know.
Yes, that sounds great. Sorry, hopping back and forth here. We go.
Sure. So one question is about the race and ethnicity data capture requests. We do occasionally encounter organizations who don't capture or have unknown. We do have an option to capture unknown if there isn't a way for you to capture that, or either overall in your patient population or with individual patients. We do, however, highly recommend that you figure out a way and going forward to capture this information, because it's really step one in trying to assess equitable outcomes for patients. And we have race and ethnicity data collection essential tools on the Target BP website to support that activity. And then lastly here, just a quick question about some health systems also provide behavioral health and dentistry care, and are asking whether or not those encounters should be included in the total population number. Really, that denominator, if you will, and total population number is really focused on the outpatient care for patients who are there for the medical diagnosis and treatment of hypertension. So filtering those encounters by that the providers who provide that type of care, meaning not dentist or behavioral health providers, may help you get to that more focused data set.
Thanks, Allison. Got a couple of common questions around check change control cholesterol and target type 2 diabetes. For check change control cholesterol, if you don't calculate ASCVD risk, but you still want to submit your MEPS data, can you still be recognized? And the answer for this is yes. As long as you answer yes, that you're committed to continuously improving your assessment of ASCVD risk, even if you're not quite there, you're still eligible for recognition, but we do encourage you to make that step forward. And then entered for target type, target BP or check change control cholesterol auto populate in the diabetes form for the 2 measure options. And that is commonly asked because it is the same measure data, but it is not currently shared between the 2 outpatient programs in the platform. So your responses for the 2 programs is not going to pre-populate, but you can easily toggle between the program forms to copy and paste your responses to make that go a little bit faster. And I think I'll just pause and confirm that we've answered all of the questions for that have come in through the Q&A and chat feature. All right, Allie, is that correct? We're still good to go there. Awesome, thank you so much. With that, I will go ahead and conclude today's call. I'll share a little bit more about where to find help. We will have another office hours. If more questions come up along the way, we'll welcome you back on Tuesday, May 4th. And then we have our contact us links posted here to make it easy for you to reach out to our teams at AHA and AMA for Target BP, and then our AQ Contact Us form for check change control cholesterol and target type 2 diabetes. And again, that IQVIA support desk is there to help you with password resets, news user accounts, and other similar help there. So we appreciate you so much for joining us today and for asking such great questions about our programs. Please visit the program websites for more information and resources, as well as the library and the platform as well. We would appreciate any feedback that you can provide in the survey link that will pop up as we conclude the webinar. You'll be receiving a follow-up email with a link to the slides, recording, and survey. So please don't hesitate to reach out if you have any further questions. We sincerely appreciate your commitment to improving the quality of healthcare and look forward to recognizing your hard work later this year. Thank you so much and have a great day.